when you look at removal of glasses, one thing which is very important is that all of us want to be encumbrance free. And the number of people who need to wear corrective glasses or lenses has gone up over the years. Everyone, if you want to live free, if you want to live unboxed, you would want that you don't need to wear glasses. So these are couple of procedures that we have, which started with excimer PRK, then there is advanced PRK, surface ablation as you call it, then you had LASIK, you have customized LASIK, and now you have the lenticule-based procedure. So these are laser vision correction procedures where a laser is used to reshape the cornea. But for all these, there have to be certain criteria that have to be met to say whether the person's cornea is eligible for getting a laser vision correction or not. One thing is important vis-a-vis laser vision correction is that patient selection has to be important. There aren't all patients who are suitable for getting a laser vision correction done. For that, we have to do detailed tests. The detailed tests include the curvature of the cornea and the thickness of the cornea and the biomechanical strength of the cornea. If these parameters are within normal limit, then and then only we go in for the laser vision correction. So if a person's corneal thickness is say 440 microns, 450 microns, then that patient cannot undergo any laser vision correction. Similarly, if there is asymmetry in the cornea, then also you cannot undergo. So there are specialized tests which we do before actually saying yes to a patient. Similarly, the amount of tissue that you can take out from a cornea is limited. So typically, we do not do a procedure which is laser vision correction which is more than say -8 or -10. So because the quantum of tissue that you will have to take out for this high power would be more. So there are limitations for doing laser vision correction. Laser vision correction has been around for more than 35 years now. I have personally been doing laser vision correction since 1996-97, and we are careful to select the right patients so that they do not end up with problems after laser vision correction. So we don't say yes to everybody, and it is not that we fit exactly the same procedure on everybody's eyes. You can change the procedure basis as to how the cornea parameters are, as to how the elasticity of the cornea is, what is the curvature, etc., etc. So that will make us decide as to what we have to do. Now, in the field of refractive surgery, where we are not taking away any corneal tissue, that means we are not ablating, that means we are not burning corneal tissue, or we are not creating a lenticule and removing the corneal tissue. There is another technology that has come out very aggressively. It has been again around for more than I would say 25 years. I did the first of this technology way back in 1999. So what is this technology? This technology is an additive technology. It is not a subtractive technology. When you are doing laser vision correction, you are taking away a certain amount of corneal tissue. So therefore, it's a subtractive technology. We are doing what is called as an additive technology. That means that you are adding something to within the eye. So what does or how does this technology work? This is like a simulation of a contact lens which you put on the cornea. Like if a person, every one of you would know what a contact lens is. So a contact lens is a refractive device which you put onto the cornea early in the morning and remove it at night. So that can be of minus power, it can be of plus power, it can have cylindrical corrections. So that is a contact lens which is added onto the cornea. But this is a daily routine or a daily procedure that has to be done. So what the technology has done is that a similar flexible, similar type of a contact lens is implanted within the eye. So this is an implantable Collamer lens or an implantable contact lens, whatever you wish to say, or a phakic lens, wherein the original lens of the patient is not disturbed, but we are supplanting that or adding on it a different lens as per the power of the individual. So this technology has really gained ground over the last several years. The important thing, as I told you, this is an additive technology. It is not a subtractive technology. You are not working on the cornea. You are working on putting in something within the eye. Therefore, the thinness of the cornea or the asymmetry of the cornea does not have that impact on this procedure as it would have on a laser vision correction. The other important thing is that, as I told you, that if we have more than -8 or -10, the quantum of corneal tissue that you have to burn, which is say about 14 microns per diopter, that becomes too large. So therefore, for high powers, you would be using this technology, which is the implantable lens, which you put within the eye. So this has again the availability of minus correction, it has the availability of cylindrical correction, and it has the availability of a plus correction. Results have been exceedingly well, and it has been approved globally now by all the agencies as being a safe device to be used within the eye for correction of refractive errors.
Follow Planet LASIK and post your queries to get answers from the experts.